Thank you, Mr. Speaker. Mr. Speaker, I think we all get that the crisis in our emergency rooms is ultimately caused by insufficient continuing care beds at the discharge end, which backs up the whole system, and we all know that'll take some time to solve, but so what? The sick people waiting up to 22 hours in Alberta's ERs need solutions now. Here's the thing. Even after 16 years of mismanaging health care, this government hasn't completely managed to stamp out the collective memory of those who used to run health care when it did work. So, to the Health Minister, here's a thought. Will the minister direct the Alberta Health Services Board to bring all staff, current and retired, to available status and to offer full-time shifts to all nurses who want them, so we not only have more health care professionals available, they're available not at quadruple time but at straight cost, lower cost, straight time?
The Honourable Minister of Health and Wellness.
Mr. Speaker, I'm open to any and all suggestions. In fact, when we met with the emergency docs a couple of nights ago, we heard some other innovative ideas. So we'll be taking a look at anything and everything that can help improve the situation so that we're meeting more than the 20 or 30 or 40 percentile mark. We're aiming at a target of 90%, and that, to my knowledge, is a new percentile for this particular suite of targets.
Thank you, Mr. Speaker. Just don't spend too long looking at things. Again, to the minister, another thought. Since several hundred net acute care beds could be open, if only he could find the staff, and since I've just given him a clue for how to do that, will the minister order AHS to open those beds and commit to have those beds fully operating and fully funded, all several hundred of them, within the next 6 weeks?
The Honourable Minister.
Mr. Speaker, when we met with the emergency docs a couple of nights ago, we talked about 4 time frames. Immediate actions, things that could be done today, literally today and tomorrow. A short-term time frame, which would be within weeks before Christmas, and a medium-term time frame, which would be within a year, and a long-term, which was within the 5-year funding framework that we've discussed. Now, as part of that, certainly they're looking at where and how more acute care beds can be opened, where and how more continuing care beds can be opened, because we recognize where the backlog is. There are too many people in acute care who ought to be
Thank you, Mr. Speaker. We're still waiting. Okay, one more try. To the minister. Since he's always going to meetings, will he actually start listening and acting on the ideas that he's hearing from physicians and their colleagues at each hospital and take specific advice, because one size does not fit all?
The Honourable Minister.
Mr. Speaker, I'm not only meeting, I'm also listening carefully, and I'm acting as immediately as possible. This morning, I visited the emergency room at the Grey Nuns Hospital, picked up some ideas there. I've been now to about 26 different emergency rooms, listening carefully to what solutions are, because they're all a little bit different. They're all quite unique, so you can't have a simple one-size-fits-all approach, nor can you have a single silver bullet approach. It's a complex issue, and that will be told to you in identical words by the emergency docs as well. So yes, we are working on those things.
Followed by the Leader of the